Each year, contaminated food sickens more people than the entire population of Texas. About 125,000 people are hospitalized. About 3,000 people die. Our national investigative team spent months digging and found a confusing system that allows communication gaps to turn into possible safety risks. Here's Factfinder investigator Chris Nakamoto.
I ate salad every day. I'm not exactly sure which day I ate it. Then I started having stomach bug issues. Very lethargic. It just got worse and worse. My doctor called my husband and said, get her to the hospital now. She has E. coli. I was starting delirium. The food that I loved and ate every day almost killed me.
Annette Martin says her case is among a national outbreak that killed 5 people, hospitalized 96, and sickened 210 people. Confirmed by samples, the lettuce was contaminated with E. coli from cattle feedlots that drained into an irrigation canal above where the produce was grown in Arizona.
When I read the hospital transcript, they had actually talked to my husband Mitch and my son Zach about putting me on life support.
Martin says doctors treated her with a cocktail of experimental drugs, and she began to turn the corner. After recovering, Martin did an internet search and came across America's leading food safety lawyer, Bill Marler.
Before the Jack in the Box case, it was completely legal to knowingly sell E. coli contaminated hamburger to the public.
Over the past 3 decades, Bill Marler's work has highlighted just how fragile and fragmented America's food regulations are. Our national investigative team spent months digging and found the system is siloed. The Food and Drug Administration regulates seafood, dairy, produce, nuts, and cereal, just to name a few. About 80% of the food you eat. The United States Department of Agriculture oversees meat, poultry, processed egg products, and catfish. The other 20%. Marler says frozen pizza is a good example of the mess. A frozen cheese pizza is regulated by the FDA. Add meat, the USDA regulates it.
Nobody would set up a food safety system the way we have it in 2024.
There are also more than a dozen other federal agencies that regulate it, along with local and state health departments. As fragmented as the regulations are on food, state reporting requirements to the government are even more chaotic and not being enforced. In 2022, the FDA reported infant formula contamination from a Michigan factory, caused the deaths of 2 babies and sent several others to the hospital, leading to recalls and formula shortages.
That FDA was actually conducting an inspection of that facility where they were making the formula, and they identified problems.
Chronobacter sakazaki was the pathogen found in the formula. The CDC added it to a watch list in January as a nationally notifiable disease, meaning it's on a list of around 120 diseases the federal government wants states to let them know about when cases pop up. But our national investigative team found as of May, it's up to each state to decide what results from patients it actually reports to the CDC. We contacted all 50 states and the District of Columbia and found 27 states report cases of Chronobacter sakazaki. 22 of them don't. 1 state and the District of Columbia did not respond.
There's no really one person in charge or a group of people in charge. The ability to go, hey, we should fix this and this is how we should do it.
It sounds like a simple fix. Why hasn't it been fixed?
There's a lot of powerful people, who like the status quo. There's a lot of organizations that ostensibly are there to support the industry.
Investigate TV analyzed 140 foodborne illness outbreaks that sickened Americans in multiple states. Federal investigators could only trace the tainted product to a farm, factory, or meat processing facility in 59 of the cases, showing how tough it is to find the source. In 36 outbreaks, they couldn't even determine which food was responsible. It's that lack of being able to trace back sources and other issues that had the Government Accountability Office first clamoring for change in 2007, with 4 presidents and Congress failing to act.
We're continuing to press for, a more unified strategy type effort that brings all the key players together.
With Martin's new outlook on life, she started growing her own lettuce and has totally changed the way she eats.
If there's a chance that it could be dangerous, I cook it if it's possible.
The Food Safety Working Group was established in 2009 to coordinate federal efforts and develop goals to make food safer. The GAO says it hasn't met since 2011. Congress passed the Food Safety Modernization Act 14 years ago, giving the FDA recall authority for food. Still, critics say that despite those positive efforts, it doesn't address the fragmentation of the system. If you have a story, we want to hear from you. Call us or email our investigators at the address you see on your screen. We'll look into any of your issues for the next Factfinder Investigates.